Hi everybody, welcome to the Optimus Health channel. Today, we're going to talk about the 10 symptoms of vitamin B12 deficiency. Vitamin B12 is an essential nutrient that helps the body use energy and maintain a healthy nerve cells. It also helps make DNA, which is important for cell growth. Vitamin B12 deficiency is one of the most common nutrient deficiencies. It is important to note that it is not clear how much vitamin B12 people need to prevent these health problems and if supplements are necessary at all. Vitamin B12 deficiency is a serious condition that needs to be addressed quickly. Before we continue, please make sure to subscribe, like, and share this video. 1. Fatigue. Fatigue is a common symptom of many conditions, but it can also be a sign of vitamin B12 deficiency. B12 is needed to produce red blood cells and to make DNA, which are essential for the body's energy production. The symptoms of fatigue can be caused by many things, including illness, lack of sleep, depression, or anxiety. It is not always easy to identify the cause of fatigue because the symptoms are so general and nonspecific. Fatigue can also be caused by other conditions such as anemia or hypothyroidism. A recent study has shown that many people who have been diagnosed with chronic fatigue syndrome may actually have a vitamin B12 deficiency and not chronic fatigue syndrome at all. 2. Depression. Depression is a common mental illness that affects more than 300 million people worldwide. Depression can be caused by a number of factors, but it is often linked to a deficiency in vitamin B12. Vitamin B12 deficiency can lead to depression because it can cause various neurological problems such as numbness or tingling in the hands and feet, difficulty walking or balancing, and memory loss. There are many ways to cure depression related to vitamin B12 deficiency. One way is taking supplements of vitamin B12 or eating foods rich in vitamin B12 such as meat, especially liver, fish, eggs, dairy products especially yogurt, beans and peas. 3. Weight gain and excessive hunger. Vitamin B12 deficiency is a significant nutritional problem. The symptoms include weight change, increased hunger and thirst. Of course, symptoms vary from person to person. The body does not store vitamin B12, so it must be consumed every day. The most common sources of B12 are animal products like meat, eggs, poultry, and seafood like fish, shrimp, lobster, and clams. It can also be found in fortified cereals and nutritional breads. It can take up to 5 years before any symptoms of deficiency show up due to the body's ability to store B12 for some time before needing more. Symptoms include fatigue, mouth sores, mood changes, and memory loss. 4. Sensitivity to cold. Sensitivity to cold is a sign of vitamin B12 deficiency. A vitamin B12 deficiency can cause a person to feel cold all the time, even when others around them are feeling warm. This is because a lack of vitamin B12 can lead to nerve damage and numbness in the extremities. The body needs vitamin B12 to make red blood cells and keep the nervous system healthy. Keep in mind that if you're vegan or vegetarian, then you may need to take B12 supplements. 5. Shortness of breath or rapid breathing. The symptoms of vitamin B12 deficiency can be quite dangerous. In fact, it's been shown that a deficiency can lead to increased work of breathing, oxygenation problems, and a weakened heart, which can lead to many other serious health problems, including anemia and neurological disorders such as dementia and depression. 6. Poor memory. Vitamin B12 deficiency can lead to neural damage or degeneration, the inability of tissues to repair themselves, and problems with brain function such as memory loss. Poor memory is a symptom of vitamin B12 deficiency. It is important to note that this condition can also be linked to age, alcohol use, kidney disease, and other medical conditions. There are many ways to treat this deficiency, such as by taking supplements or foods fortified with the vitamin. 7. Tingling or numbness in hands and feet. Vitamin B12 deficiency is a common yet serious condition that is often overlooked. Tingling or numbness in hands and feet are one of the most common symptoms of vitamin B12 deficiency. Other symptoms are fatigue, weakness, muscle pain, and difficulty walking or climbing stairs. A person with vitamin B12 deficiency may also experience some neurological problems like memory loss, depression, and confusion. If left untreated for a long period of time, it can lead to more serious complications such as heart disease or Alzheimer's disease. The symptoms of vitamin B12 deficiency can be mistaken for other conditions, and those with the condition may not even know they have it. 8. Poor balance and coordination. Vitamin B12 is an essential nutrient that is necessary for normal brain function and red blood cell formation. In order to be able to absorb the vitamin, it must be bound to a protein called intrinsic factor, which is produced by cells in the stomach lining. When there is not enough intrinsic factor, or when the stomach lining has been damaged or removed, vitamin B12 cannot be absorbed into the body. This can lead to many symptoms including poor balance and coordination. 9. Sore tongue. Sore tongue is a symptom of vitamin B12 deficiency, which can be treated with supplements or a blood test. Symptoms like sore tongue are caused by anemia and low levels of iron. If you have symptoms like these, it's important to contact your doctor as soon as possible for diagnosis. The best way to get more B12 in our body is by eating foods that are fortified with B12, such as breakfast cereals or soy milk, or taking a supplement. Vitamin B12 is a vitamin that has many neurological functions in the body and also helps with energy levels and heart health. We need to make sure that we are getting enough of this vitamin in our diets because deficiency can lead to severe problems like anemia and depression. 10. Hair loss. Hair loss is a common symptom of B12 deficiency. The body needs this vitamin to grow hair, so when there is not enough, the hair can thin and fall out. Researchers have discovered that people with hair loss are more likely to have vitamin B12 deficiency. While it is not known exactly why vitamin B12 deficiency causes hair loss, it is thought that the lack of vitamin B12 helps trigger a gene which leads to hair loss. One study found that the rate of hair loss in people with vitamin B12 deficiency was 4.5 times greater than those without it. In conclusion, there are many causes of vitamin B12 deficiency including a vegan diet, low stomach acid production, and intestinal disorders like Crohn's disease, celiac disease, or colitis. If you are having these symptoms and they persist for more than a month, you should visit your doctor. Thanks for watching. Don't forget to check out our other videos in the channel and subscribe to be part of the family. Turn on notifications so you don't miss anything. Remember, stay strong and live long. I'll see you in the next video.